Hi, everybody. Okay, so for my research topic, I chose Tourette syndrome. So let me present my screen for you guys. So I hope you guys can see me right now. Think you should be able to. Okay, so I chose Tourette syndrome. So I'm going to share a little bit of information on Tourette syndrome with you guys today. So to get started, what is Tourette syndrome? If you're not aware, I'm going to let you know. So according to the American Brain Foundation, Tourette syndrome is a neurological disease characterized by involuntary, repetitive movements and vocalizations called tics. While Tourette syndrome is considered a movement disorder, it is also a brain disease. Its cause is unknown, but current research suggests tics may happen when there are problems with how messages travel through the brain, such as abnormalities in certain areas of the brain or in communication between nerve cells. So tics are sudden movements, twitches, or sounds that people do repeatedly, and people who have tics cannot stop their body from doing these things. So, again, like I mentioned prior, it is a neurological disease. So, these people aren't doing these things on purpose, it's involuntary. So, what does Tourette syndrome look like? And I've listed some characteristics within the classroom and then some without or outside of the classroom as well. So, inside the classroom, students who have Tourette syndrome may have difficulty concentrating in class because they are focusing on trying to control their tics. So, it can be hard for them to pay attention to the actual lesson because they're trying so hard to suppress their tics that they're experiencing because they don't want to interrupt the class, or they might feel embarrassed by their tics from their peers and things like that. So it can be really difficult for them to concentrate once again because they are trying to suppress their tics. They may do or say inappropriate things. And once again, these are just, their tics that they're experiencing. Some tics that people have do happen to be inappropriate words or inappropriate things that they might do or say. Students with Tourette syndrome may need to have breaks from instruction if they need to release some of their symptoms, or if they have any techniques on relaxation that can possibly help reduce the intensity of their tics. They might want to do that as well. So if they need to just step out for a minute to kind of calm down a bit, relax a little bit, things like that might possibly release some of their symptoms, they might need to do that as well. They might also be absent from school quite a bit or dislike being at school because they could potentially be a little bit embarrassed by their tics, as I mentioned earlier. So, students with tics or students with Tourette syndrome who experience tics may, again, not want to be in school, so they're absent frequently. And then because of all of that, they may have poor school performance as well. And then what it looks like outside of the classroom is that people with Tourette syndrome may have difficulty integrating into society as well as coping with daily activities. And this kind of goes back with, just feeling embarrassed potentially from their tics that they experience and things like that. And then some people with Tourette syndrome may avoid stressful situations that can trigger their tics. So not wanting to go out and do certain activities and things because they're worried that they, could be stressed out, and then that might trigger a tic. And then typically symptoms are worst within the teenage years for somebody who is diagnosed with Tourette syndrome. But it is possible that the symptoms of Tourette syndrome can go away into adulthood, and those individuals will no longer require treatment if they were going through treatment at all. And with that being said, not all individuals with Tourette syndrome will require treatment. However, the most common form of treatment is neuroleptics, which is a form of medication, and that helps suppress their tics. So I just put on some possible examples of tics that, you might see in somebody who has Tourette syndrome. So I'll read off some of those for you guys. So possible tics would be facial grimacing, shoulder shrugging, head or shoulder jerking, grunting, barking, repetitive throat clearing, hopping, jumping, bending, twisting, repeating one's own words or phrases, and then using vulgar, obscene, or swear words. And so again, so some of these tics might not be as noticeable, and then others maybe. So things like, clearing your throat, you might not realize that that's a tic of Tourette syndrome in somebody, because, I feel like that's kind of a common thing that a lot of people do. So some of their tics could be, not as obvious, but then, doing things like barking might seem a little out of the ordinary for somebody. So they kind of range. Okay, so then getting into the classroom and what this could look like for students in the classroom. So things to consider. It's important that tics are not perfect. I'm sorry. It's important to remember that tics are not purposefully done by students with Tourette syndrome, but rather that it's neurological, as I mentioned earlier. So, as teachers, it's important to understand this and be patient if a student is experiencing tics within the classroom. And then I've also pulled some quotes. So, the Tourette Association of America had a lot of really helpful information on the topic. And so I pulled some considerations that they had mentioned on their website. So, one of them, according to the Tourette Association of America, they state that. Tics can be suggestible. Reminding the student not to tic may be counterproductive. For instance, if someone tells you not to blink for the next 2 minutes, you might be able to resist the urge, but being reminded will make it more difficult. Similarly, reminding a child not to tic will often increase the urge to complete a tic. The added stress to control the tic may increase anxiety, exasperating the urge to tic. And then another quote that I pulled from the Tourette Association of America is that suppressing tics can affect academic performance. Just as we are sometimes able to suppress the urge to scratch an itch, students with Tourette syndrome are sometimes able to suppress tics for a time. However, the mental concentration and energy to suppress the urge can be distracting to academics. So obviously that's not what we want for our students. We don't want them to suppress their tics, because then that's, obviously going to affect their academics overall. So we obviously don't want them to have to feel like they have to suppress their tics in order to, not be a distraction or anything like that, because we don't want it to, overall affect how they're doing academically. And then a final quote that I pulled from the Tourette Association of America is, stress almost always increases tics. Helping the student with Tourette syndrome to avoid stress may include privately letting a student know when you can call them or when you will call on them. It also may be helpful to offer testing in a separate location with extended time or reduced workload. So again, just little things like that, like letting the student know when you are going to call on them in class, can help them avoid their stress spiking and things like that, because when they feel like they're getting stressed, then obviously their tics are going to start to increase and things like that. So trying to help them maintain their stress levels as much as possible. So then I have a few strategies that teachers can use within the classroom to help students who do have Tourette syndrome. So one of the biggest strategies teachers can use with students with Tourette syndrome is to ignore tics as much as possible. Bringing attention to tics only draws more attention to that student. And then once again, I also pulled another quote from the Tourette Association of America, which states, when teachers model planned ignorance, bullying is reduced. And then another strategy is that it may be a helpful accommodation for students to leave the room to express their tics. However, other students may feel like this is a punishment for something they can't control. With that said, making sure not to ostracize children with Tourette syndrome. So, some students may find it helpful to leave the classroom for a minute if they feel like their tics are getting, a little bit out of control and they need to try to, calm themselves down a bit and, find relaxation and things like that. But other students might feel like they're being punished by having to leave the room to, express their tics. So just keeping that in mind. And then using accommodations when necessary for students with Tourette syndrome. So, as I previously mentioned, it could be helpful to provide a separate testing location so that the student feels more comfortable when they're taking their test, which will allow them to perform at their best. Um, because if there is a quiet room during testing, a student with Tourette syndrome is going to focus all of their attention on trying to suppress their tics so that they aren't distracting their peers, which then is going to affect their overall academic performance. So, since they're concentrating so hard on suppressing their tics, they're obviously not going to be performing on their test quite as well as they would be. So, again, like offering them a private room or a separate area where they can feel a little bit more comfortable taking their test. And then a final strategy is tics will be less of a distraction if other students in the classroom know that they are likely to occur and why they occur. So, speaking with the entire class about what Tourette syndrome is will normalize it and make students feel more compassionate towards their peers who have it. So, once again, just normalizing it, like making that student feel like it's nothing to be ashamed of. And then again, that way their peers know, like, okay, so that's why this is happening. They're not just having, because otherwise some students might think, oh, like, what's going on? This kid's having an outburst right now. But if we normalize it and make it, known that this is a normal thing and that it could occur during class, then the rest of the students won't, feel so surprised when it happens or when it occurs within the classroom. And then just a few examples of assistive technology for Tourette syndrome. So there's various recording devices that are helpful for students with Tourette syndrome because it can be difficult for them to take notes during class. So with a recording device, they are able to just record the lesson and then they can, go back and listen to that if they need to. And that just makes it a little bit easier than taking physical notes for them. Because with Tourette syndrome, it could be a little bit hard with their tics to be able to like take normal notes in class. And then another assistive technology is being able to pre-record their presentations. So, for example, if a student has to give a presentation in class, for a student with Tourette syndrome, having to give a presentation can cause a lot of stress, which then therefore will cause them to have a lot of tics. And then it's going to be really hard for them to be able to get through their presentation. So in order for them to be able to present their presentation with minimal stress and anxiety, the student can record their presentation at home and then play the video for their peers in class. And then a final example of assistive technology would be reader softwares or audiobooks. It can be difficult for students with Tourette syndrome to read if they have visual tics. Having visual tics makes it difficult for these students to then focus on the text. And then with that said, being able to use the audio reading or audiobooks allows students to listen to their text rather than actually reading it. And so then that therefore allows them to, comprehend a bit more than them actually reading. And then just a few really cool like services and resources that I found. So this one is actually coming up. So if you're interested, there is an event. It's a virtual event called TicCon, and this is a this is a national virtual conference of the Tourette Association of America. And as I've mentioned before, the Tourette Association of America is a great resource as well. Like just their entire page is just a great place to go for additional information. But back to the actual event of TicCon, this event will be taking place on May 19th and 20th of this year. And the goal of this conference is to offer support to those who have Tourette syndrome, and then additionally offer parents, siblings, educators, etc., the opportunity to learn more about how to support someone with Tourette syndrome. So I've provided the link for that as well. And again, just a really great, conference for people who do have Tourette syndrome to go to find support, with people who also have it, and then people who are family members or teachers. Just a great resource for them to be able to maybe learn a little bit more on how they can help support somebody in their family or a student who does have it, and things like that. And then another great opportunity for anybody who does have Tourette syndrome is they have an online support group. And this support group is offered the second Wednesday of each month from 7 o'clock to 8:30 p.m. Eastern Standard Time Zone. And again, this is via Zoom as well. So really cool to have the virtual options, virtual aspect. And this one is offered for young adults who are ages 18 to 25. And you have to have a Tourette syndrome diagnosis to be able to attend this support group. And the goal of this support group is to bring individuals together who can share their experiences with Tourette syndrome and make connections with one another, as well as offer support to one another. And then the final support service that I found is the Pennsylvania Tourette Syndrome Alliance. And they provide support to schools, families, communities, and health professionals on all things Tourette syndrome. They offer information on They offer information, on Tourette syndrome. They provide additional resources and supports, and they even hold events like camps and retreats. So another really cool place to just find more information. If somebody has Tourette syndrome, like the camps and the retreats could be a really great opportunity, and all those kinds of things. So those are the 3 support services and resources that I found. Again, really great opportunities for anybody who does experience Tourette syndrome, who has the diagnosis and could just use additional support, wants to talk to somebody who, also has it, and just, share their own stories and just receive support from one another and things like that. So just really cool opportunities.